In high-hazard industries, accidents can result in devastating losses. One of the aspects that is paramount to ensuring a safe working environment is safety culture. Culture is not just about art or drama, and our culture is not something we should only notice when it clashes with others. Culture is best defined as how we do things around here. What we wear, how we talk, our attitudes and priorities. And it is by focusing these norms on safety that we can create a safety culture. When mistakes are made in healthcare, the consequences can be just as severe as in industry. And so, to improve the safety of healthcare for patients, we should recognise relevant concepts from other safety-critical industries and identify how this knowledge can be adapted to help healthcare. A poor safety culture in a hospital could result in the wrong medication being administered, the wrong site being chosen in surgery, or even the wrong patient being treated altogether. A good safety culture can make an organisation less vulnerable to incidents and accidents. But before we address safety culture, we need to understand it. Most of the safety culture techniques used in healthcare are based on surveys or questionnaires. These provide scores on a range of themes, such as teamwork, but the cause of the problem can be difficult to determine from the numerical values. A survey could indicate that there is a difficulty with communication, but not give enough detail about the problem to know how best to solve it. To compare, in one unit, nurses thought that important information should be communicated verbally, face-to-face, whereas doctors preferred to use written messages on a patient's notes. And in another unit, no time was set aside to ensure that staff could get together and communicate as a team. A survey would show both of these situations as a problem with communication, but only when we add interviews do we understand the details to be able to choose the right solution. To better understand safety culture, we have developed a mixed methods approach that uses a survey to highlight the overall areas of concern, supplemented with interviews with the staff to provide a rich description of what the problems involve. The results are then used to guide action planning through an interdisciplinary workshop, ensuring that the solutions are tailored specifically to address the problems.
DNVGL has a long history of assisting safety-critical industries in improving safety. In strategic research and innovation, our objective is to take the best practice and learning and adapt it to healthcare. To help us understand how the mixed method of assessing safety culture will work and be perceived in healthcare, we have piloted the method in the healthcare setting.
Safety culture is a difficult problem to assess and then address. We've really valued being part of DNVGL's research process, as it's important to continually develop new tools in this hugely important area. The workshops with the clinical staff help us to explore what staff were feeling about the local safety culture. This has been a really helpful process for the Trust, as it opens up the debate about how important culture is for safety. This helps us develop so that we are at the forefront of safety improvement.
As a Trust, we're always looking for the best techniques to improve safety performance, so we're keen to be part of DNVGL's pilot study. We particularly liked their methodology of using interview and questionnaire, which gave us valuable insight into how we could improve our patient safety.
With our vision to have a global impact for a safe and sustainable future, together with our 150-year history of assisting safety-critical industries in improving safety, we believe that DNVGL is in a unique position to improve patient safety globally. Wherever safety matters, safety culture matters too.